everybody. My name is Rachel Udamapu, and I want to welcome you to this Look Good Feel Better Q&A session for, my goodness, we're all the way through July. The year is absolutely flowing. Now, I hope you're all warm and dry and snuggled up wherever you are around the country. We're absolutely excited this afternoon to be delivering this session. We've got a fantastic guest speaker, and also just want to do a wee shout out because today we have record numbers of registrations for the session, which is absolutely fantastic. I would just like to say that during the presentation and the talk today, we won't be providing any medical advice or answering questions that are specific to your individual medical situations, but rather we encourage you all to speak to your doctor or your oncology team if you've got personal health and about your personal health and treatment plans. So with that, I would love to introduce you to the wonderful Desiree. So now join me in welcoming Desiree De Spong. Desiree is an expert in lymphatic therapy, and Desiree is going to provide us with an informative session on how cancer and its treatment can affect your lymphatic system. Then she's going to provide us with some really great tips on what you can do to support that. So Desiree, thank you for coming along, and I'll pass it over to you.
Kia ora koutou, everyone. It's a pleasure to be here. I'm going to share my screen and just make sure that technically we're all working well. So there was lots of really good questions, and the lymphatic system is probably one of the most known, underrated systems in our bodies, and so we often find that it is an area of concern, and also not understanding it means that you're not empowered to do something with it. So today, hopefully, I'm going to be able to allow you to feel that you are empowered with some choices to help yourself and your own self-care journey. I am going to give an overview of the lymphatic system. I think it's really important to understand how it works, and then you understand why we ask you to do certain things in your care. And I will be leading in amongst that is answering some of your questions as I go through, but I have got a few of them at the end, so I will try to cover everything that's already come through to date. So I'm not going to do too much over the top anatomy and physiology. This isn't a, walk away with a medical degree here. I will keep it simple. And but probably the first thing I want you to just think about is the lymphatic system is like a river. It's like water flowing in your body right now. We're made up of about 85% water. And the lymphatic system is a big part of what goes on in how your fluids are moved out. So think about it like a drainage system. The key to it is maintaining balance. So you'll see in this little visual, so what happens is that we all know about our heart. We know about our circulatory system. The heart delivers nutrients and oxygen to our tissue. And then we have what we call a venous return, is taking some of the blood back to the heart. But in between all this, the major role that's being played for you is this little capillary here that's actually designed to draw fluid in from around in the tissue that's actually around where your cells, the fluid around your cells, it's trying to draw in fluid into these capillaries so that it can actually do something effective with it and remove certain fluid that you don't want there anymore. If our lymphatic system didn't work, basically we would die within 48 hours. So it is playing a very pivotal role in your overall health. So what happens is when it enters these capillaries or vessels, the fluid is then going through a cleansing process. So like a river and a stream, you've got water running. Now we all know what happens. I mean, I as a kid was one of those children in the bush that would put rocks and tree trunks and stuff in a river and you'd create a dam. Well, the same thing happens in our body. And I'm going to talk more about when we've had surgery and, lymph nodes removed, why it affects your actual lymphatic system. But really, the lymphatic system's a bit like your garbage truck of the body. It is designed to move fluid out, filter it, and move it back to the heart. And then it will go and get cleansed through the liver, and then you'll urinate, bowel, or breathe. You can actually breathe out, or you can urinate. So those are the skin as well. You'll sweat it out. So those are the main ways we eliminate. There's also more recently we've found out we've actually got a lymphatics in the brain. So without getting too technical, it's the way we drain our brain. So for those of you that have gone through chemo, you know what brain fog's like, or we used to call it chemo brain. It was always a thing that really did impact on how you felt. And so within the system is actually the ability to drain out through our lymph nodes and through our spinal fluid. And it's actually there to clear the lymphatics of the brain, or to clear the byproduct of your brain. So ironically, though, the only way that works really effectively is usually with 7 hours sleep at night. And that's usually another issue that's going on post-cancer therapy, is having a good night's sleep. I'm sure you're all aware of that one. So how the lymphatic system is functioning. So we've talked about a vessel. We've talked about it pulling fluid in from your tissue. It's now going to go through a series of pipes, for want of a better way. So we go into what we call a pre-collector and a collector. Think of it like you're flushing the toilet and you're sending fluid into the pipeline, and then it's going to go the main trunk before it goes to the transfer station. And I think one of the biggest things that have come up in some of these in these questions was more around, what about my lymph nodes? So your lymph nodes are a powerhouse of immunity. So think of them like the transfer station, actually. You could think about, like, you know, when we send stuff to the dump, for example, we decide what to recycle. We decide what needs to be destroyed. This is a very similar behavior when the fluid enters into your lymph node. So we have all our lymphocytes in there. So we have what's called a B cell, which is actually creating an antibody. We've got a T cell, which is designed to, it's a little bit like the general of the army. It decides who goes in and fights the byproduct that's in the fluid. So it can be anything from proteins through to viruses through to cancer cells. And then you have NK cells, which are actually natural killer cells. So think of that of the front line. So the soldiers at the front that are dealing with this. So those lymph nodes have all of this going on for you when every time your fluid is entering in there. It's trying to cleanse it and get rid of impurities that are sitting in that lymph node from the fluid that's actually come through. So lymph nodes are basically everywhere in your body. Now, you could argue there's anywhere between 600 to 1,000, depending on which textbook you want to read. But the main ones are up in your cervical nodes, which is in your neck. So someone mentioned about having swelling in their neck post lymph node removal. That's because they aren't optimized in their drainage. You can have them down in, there's some here on the side, so between the shoulder blade and the armpit. You've got them in your armpit, so we call them axilla. You've got them running down the side of the breast, so they're called pectoral. You've got them down the center of your chest, which is called parasternal. Then you have some deep ones that are in your abdomen. You have them in your hip line called iliac. You have them below your legs, you've called inguinal, and then you have a cluster behind your knees called popliteal. And then you still have them around your organs, a little bit like a pearl necklace. So we have a lot of them, and over half of them are in your abdomen. So there's a lot of lymph nodes going on. And the reason I stress that is one of the things I often get told is I had all my lymph nodes removed. And that doesn't occur, even in breast cancer surgery. I had the benefit of going in the US to watch breast cancer surgery. I watched a lumpectomy. They took lymph nodes out as a sentinel node biopsy, so I got to feel lymph nodes. I watched a bilateral mastectomy, and it became very obvious they don't take them all. So for example, you have around about 60 in that breast chest area. And so when someone comes in, like a surgeon, to do a clearance, they're doing it particularly in the axilla or the armpit area. So that still means that you have them, for example, what I mentioned before, the pectoral, so the side of the breast, the parasternal down the chest wall. You have them up through the actual shoulder line there. And there's actually a small cluster around the back called subscapular. So as a practitioner, we're trained to show you where the other lymph node groups are so that we can actually help you utilize those areas to drain more efficiently. And we'll talk more about that a bit later on. So the advantage about working on lymph nodes is if you increase lymphocyte activity. So the more we move, the more fluid we move, the more chance we've got a better immune response. Some of the questions are asked about, does cancer spread into the lymph nodes? That's its job. I talked about that before. All fluid that goes through through the lymph nodes is going to have some form of cancer. Even someone like me that's never been diagnosed, there is still cancer cells in all our bodies. The thing is, for me, if the lymph nodes can do their job effectively, they will hold, as in they'll be less involved. So, for example, if you've had a clearance of lymph nodes, they might find 2 out of 5, and that means it sustained it there. If they took out 15 and they found 5, that still means you had 10 that didn't have cancer in. So there is no real certainty that if there's cancer in your lymph nodes, it'll spread throughout the rest of your body. It is something that medically we will say that it does increase the chance, but we still cannot be 100% sure. So never give up on the fact that just because it's in there, it will mean a long-term issue. It is something you want to talk to your oncologist or your surgeon about, because for me, it's more about addressing it head on. Like, what can I do? What is the options available for me? So you're not just leaving it. Some people just leave the lump and don't get it checked out. And I would stress you always go and get it checked out. So the impact of the blockage is real, no different to we've recently had some flooding. I mean, we're seeing it worldwide. If flooding starts to occur and there's a blockage, like I mentioned earlier about putting the stones in the river, what will happen is you'll get a buildup of fluid. And this is what occurs in lymphedema, which we'll talk more about soon. And then that means that you're getting an ongoing issue, especially with the change of the tissue. So cellulite is a good way to explain it. When we have cellulite, you start getting an accumulation and it just doesn't go away. It gets more and more. It's because there's a blockage in the system and we're not removing out that fluid into those vessels correctly. These are the 3 things I want to voice the most and really take away from this is that we don't have a pump like the heart. The circulatory system has the benefit of that. The lymphatic system doesn't. So in other words, if you don't move, it doesn't move. And unfortunately, it's working against gravity. So it has to push all the fluid. If someone's dealing with leg lymphedema, you've got to get it up into the back of your knee, into the upper leg, into the groin, right up to get into your left subclavian, which is the vessel that enters into the heart. It has a lot of work to do to go up against gravity. So some of the main ways that we do move lymph is through movement. And we're going to talk more about that soon. It is about breathing deeply and effectively. So not shallow breathing, it's diaphragmatic breathing. That helps push the fluid up through the chest wall to get back to the heart. And then the other one is called utilizing what we call the lymphangion, which is a muscle that's attached to the lymphatic vessel. And the way that works best is through what we call parasympathetic, which is your autonomic nervous system's way of rest and repair. So in other words, sleep and rest. And those things are imperative, those 3, to actually get your lymphatics moving. The key is to keep the river flowing. No different to if we had the toilet and we couldn't flush it over a period of a day or 2, we know what the implications of that would be. And I know it's not the nicest analogy, but it gets it quite real as to what would happen if your lymphatic didn't flow. There's one really important part too when it comes from a lymphedema perspective is the vascular system actually leaks what's called blood plasma protein. And the lymphatic system is the only system that can move it back to the heart. If it accumulates, it starts to create that thickening or the pitting that you see with lymphedema because it's actually not being removed out through the body. So that's when we know that things are in trouble, is when we're getting a change to the texture of the skin. So another analogy, if we don't want to talk about the toilet, is just think of an aquarium. You've got this beautiful aquarium with fish in, it's swimming around. And what happens if you don't have a filter? If that filter isn't pumping, it isn't getting rid of the waste product of the fish, over time, as you see in this picture, the fluid changes and you're starting to increase inflammation. You're starting to get more major issues going on in the tissue, which then affects your organs and your overall health. So for a summary, and for those that don't really, want to understand it all too complexly, here's a simple video to watch. That's your hairs on your skin. The lymphatic system is just in under the epidermis, so under the skin. It starts with this blind-ended capillary, and it's drawing the fluid in, taking it to, as I said earlier, a pre-collector and then a collector. So just like, as I said, flushing the toilet, it's going into the different trunks to get to the waste system or the waste center, where it will go and actually be cleansed and managed. So no different to here if you're at, we've got a big wastewater system here in Tauranga. It will go through at least one lymph node before it makes it back to the heart, but in most cases, your fluid is going through 30 to 40 lymph nodes before it's actually back there, so it's filtered, cleansed, and then moved back into the blood. So what are the benefits? Ironically, the lymphatic system is, as I said, underestimated, but it's going to reduce inflammation. It's going to help you with joint pain. It's going to help with, obviously, lymphedema, swelling. It's going to reduce any sort of chronic issues, autoimmune. It helps with digestive problems. So the lymphatic system is your immune system. So it not only gets rid of the waste, but it's boosting your immunity. So at the end of the day, it's playing a big role in how well you recover, but also how you maintain health. So let's move into recognizing the signs. This is key. Prevention is better than cure when it comes for lymphedema, and self-management is really important here. And I would not stress enough, in my years of being in this industry, think of it like cleaning your teeth. You need to do something every day, because especially if you've had lymph nodes removed, your lymphatic system's been compromised. It's minimizing the amount of filtering that's going on. So you want to be able to support it. No different to if you hurt your shoulder and you're trying to create a recovery, or, if your best friend got sick, you're going to try and help them get well. Self-care is paramount when it comes to prevention of lymphedema. So it is an accumulation. It is a swelling. It can change tissue. And to be honest, we do not know to this day what the main cause is. We do know lymph node removal can increase your chances. We do have certain risk factors, but I could honestly say to you all that there's no guarantee who will get it and who won't get it. We haven't been able to ascertain that yet. They're still looking into it, but I can have, patients with 2 lymph nodes removed and have it, and then patients with 15 lymph nodes removed and never get it. So the key for it is noticing the signs and then acting on that pretty quickly. So it never comes to anything more than an initial swelling, because it goes into staging after that. And when we go into staging, that means pitting, which means I can push my finger into the area and it'll leave a mark, right through to it actually changing the density of the tissue if it's left long enough. So it's basically lymph node removal, or there is a primary lymphedema, which can happen at certain stages of people's lives where they actually get different series of events happening at certain ages. But mainly what we see is the secondary, which for those who have had lymph nodes removed and who have had surgery and who have had cancer, I'm sure there's enough on this group that have understood that what secondary lymphedema is. But the main factors that we're looking at is usually there's trauma or tissue damage that's occurred. So this can even happen in a car accident, for example. Immobility is a big part, infection. So one of the things I do want to raise is if you ever get a redness in the skin, you start getting flu-like, or you're not feeling well, I would recommend that you get immediate medical attention. This can be cellulitis. If you don't know what it is, go and learn about it. It is something that can be so severe that you can end up in hospital with, and it's usually an infection that's occurred where the lymphedema is. So this is one thing to always be mindful of. So what are the risk factors? So basically it comes down to how many lymph nodes. Yes, that can play a part, the extent of the surgery, the amount of trauma. BMI can also be an issue, infection and immobility. So when they're removed, it does and can be a side effect. But as I said earlier, we're not 100% sure why some do and some don't get lymphedema. We had a couple of comments and questions around the reason, like I've got swelling on the side of my neck or on my legs or my arms. This can all occur from the surgery you've had, the type of surgery. So in other words, what scar tissue are you managing right now? How many lymph nodes have you had removed? How was your recovery? So did you get your full range of motion back? Are you active? There's so many reasons why this swelling can occur, and that's why we'll talk more soon around how you can actually intervene on some of those and hopefully help yourself from actually going on to having further issues. Even down to someone mentioned about a lump being removed. It can be the trauma of the surgery alone that does it. And that's why, as I said in those other risk factors earlier, that it can even be in a car accident. We don't always know why it occurs. The key for me is prevention is better than cure. So if we can find ways to think of it that we're looking after ourselves every day and just doing like even a 10, 15 minute or 5-minute lymphatic support, it will help with maintaining and also with preventing if you've not gone down this pathway. The key is to see it early. So obviously swelling in the limb is the real one that we're starting to see. It can occur in the chest, breast area. It can occur in the shoulder area, the neck. It can occur in the abdomen, the upper legs, the lower legs. This is all indications of areas that you can get swelling, and that tells me then that there's a block in that lymphatic structure, and the key is to start to do something to move that. Heaviness is another one. So it will feel weighted, it will feel different, or it can be that you've lost sensitivity as well. So you might be able to run up your hand up your arm and find that you just don't feel it as much as what you would the other side. The skin will start to change as well. So we've talked about, someone mentioned scaly skin. That can be something that becomes apparent. We'll talk a little bit more on how to manage that later. And then obviously wearing garments. So one of the big things I see with breast cancer is women will say that one sleeve is loose and the other sleeve, they notice it start to becoming tight. So that's an indicator as well, it's changing. And then if you do start to have some infections in that area and you're not healing as well, that's actually a good sign as well. So it's noticing change, and the sooner you notice the change and the sense of, I just noticed that, for example, my arm would swell on a hot day because with heat, we do get what we call vasodilation. So we do tend to get more swelling at the summer time of the year because it's just a natural aspect. But the key to observe is, does it go down overnight? If it's not going down overnight, then that tells me you're starting to get an accumulation. So, or my rings are getting tighter, that's a good one, or my socks are leaving really definite marks in my ankles. These are things to notice. So what are our options? And I know that all sounded doom and gloom, I'm so sorry, but I wanted to be very open and honest about this is an area that I want you to take seriously, because I feel that your quality in life is so important. You've been through enough. Why add another issue to it? So I'm going to take you through a few different ways. So one of the big things that we get to talk about is manual drainage, and it can be really effective. The key is to do it correctly, and that's what's really important. If you're going to do it, let's learn from the experts. Now, unfortunately, fortunately, some of you would have already seen your physiotherapists. You may have gone through the hospital. You may already have therapists that are helping you. But if you're looking for someone online to refer to, there isn't many in New Zealand that are into Instagram and YouTube that have that oncology background. So there's this wonderful woman, Kelly Stern, and she's based overseas, but she has some amazing resources. She is well trained. She is able to show you different techniques through YouTube and Instagram, so you don't have to pay for this, because the key is, you had many ask me, how do I drain my leg or how do I drain my breast tissue? And this is someone I would recommend highly. I'm very careful who I recommend, especially in the cancer industry. And I would feel that Kelly is probably one of the best that I've found from a visual point of view of being able to find something to help you on how do I drain my lymphatics with my hands. We mentioned breathing. And I know we're all breathing right now for obvious reasons. We're sitting here. But the reality is a lot of people don't breathe efficiently and effectively to actually move lymphatics, but also bearing in mind that on the side of this, you've got your autonomic nervous system. I mentioned that before, and we've got fight flight, which a lot of us know about, especially since going through a healing journey, and also with all the stuff that's gone on in the world. We're kind of living in a little bit of a what's next scenario, and that really puts an impact on our stress response. And then we have what I said earlier, parasympathetic, which is your rest and repair. If we want someone to truly heal and come back and recover, breathing helps not only from an oxygenation and from a lymphatic point of view, because it will actually help you eliminate the lymph almost 15 times more than normal by doing diaphragmatic breathing. But the best part about it is it engages your parasympathetic nervous system. Parasympathetic nervous system, rest repair, also then improves your drainage, like I talked about earlier, from the lymphangion. So think of it like a towel squeezing. That's what it's doing through nighttime. So the more that we can learn our breathing techniques will actually, or more efficient breathing techniques, I should say, it will help. So from my experience, and most of my clinical patients were breast cancer as a rule, and I found probably about 98% of breast cancer patients didn't breathe effectively, and they were very shallow in their breath. So this is something I do want to encourage you all. It's free. You can do it any time of the day, and it will reduce stress. It'll lower your blood pressure. It will help with digestion. And obviously, from our point of view, it will help with lymph. So some of the questions I get is, well, how do I change my breathing? This is a really good one where you're actually doing a count for 4. It's called box breathing. So you're breathing in and you count for 4 as you breathe in. You hold for 4, you breathe out for 4, and then you hold for 4. Now that may be really hard to start with, so just do it for 2. Or the other way you can do it is get yourself a straw, and what you're going to do is breathe out through the straw. So you're going to purse your lips, put the straw in your mouth, and breathe out. What that does is it helps your body let go, so it will let go of stress, but it also helps the diaphragm drop, which means you're pushing your stomach out a bit harder, and then what happens is you take a deeper inhale. So one of those 2 options will make a significant difference both in how relaxed you feel, so it's a great technique to do as you're about to go to sleep, but more importantly, it's helping from a lymphatic point of view as well. Embracing mindfulness. One of the greatest breakthroughs I realized over time, now just to give you some context, my sister went through stage 4. She had bowel that perforated to liver. And so I walked the journey with her. So it was one thing to work in a clinic, but then to work with your own sister, it was very challenging. And so one of the things I introduced her to was mindfulness. In other words, controlling what the mind is thinking. Now, I'm very proud to say my sister is still here 6 years later and clear of cancer. So that was just to show that, you know, combining everything and your care can make a significant difference. But mindfulness is about the mind, not overthinking or over worrying. And the reason I say that is your body can't differentiate between the thinking and the reality. So for example, if you're worrying about something you have to do tomorrow, what if, the body is pumping adrenaline or cortisol to actually get you prepared to deal with that now, not tomorrow, now. So what that means is it's increasing your stress response in your body. So the idea of mindfulness is to stay present in the now, not worry about tomorrow, be in the moment. And then your body isn't putting you into that autonomic dysregulation of being in that fight flight. And that will then increase swelling, especially the stress aspect of it, but it'll also cause inflammation in the body. The other one is to get moving. I talked about that. We do not have a pump. We are relying on muscular skeletal movement. So this doesn't always mean you have to go out and start running. And I'm always very quick on being careful if you're going to join a gym, that you're actually working with someone that understands how to bring you back into that environment, especially if you've had some major surgery. For example, if you've had breast cancer and you're trying to lift weights again, you'll overcompensate. So you'll be using your strong side, then your weaker side will get injured. It really is about a very controlled process. So one of the things I have learned over the years is some of the best research I have found is actually in yoga. So from a lymphedema perspective, it's probably one of the best I have seen to actually show it makes a significant difference. And the main reasons are, A, you're learning to breathe efficiently. B, you're learning to move into different techniques and stretching. So between those two, you're actually creating the movement to actually get lymphatics moving. So it's easy to find research on yoga if you're looking, but the key is to move. So it can be walking around the block, something where you're actually getting your body to pump muscle so that then the muscle will help move the lymphatics. So I was also asked about vibration plates. One size doesn't fit all. Some of them can be like rattling your teeth. They're not so good for your lymphatics. And the key is, if you're working on vibration plates, is making sure that the vibration is right for you. So you do not want to feel uncomfortable. You do not want to feel like you're feeling very, dizzy or anything like that. And I was asked about research. To be honest, there isn't a lot of research. I know the person in question brought up the 2010 one with the German Society, and that was, it did show benefits. There was also another one that I found that it did conclude that the compression vibratory combination devices, but also with the physiotherapy, was what made the difference. So I don't think, we use it in the lymphatic industry. So for example, a lot of people are using it as part of their recovery or their overall wellness. So it's not going to be adverse, but the key is to find one that you can stand on, that you aren't causing too much stress on your joints. So never lock your knees. You're always in a slightly bent position, and allow the vibration to go through the body. And as long as you're not rattling your teeth, it would be fine. This is one, so, we've talked about, obviously, those of you that have got lymphedema of the legs. This is, again, a goodie, like for this. So if you really want to take it to another level, so obviously, to be honest, I feel this is great for everyone. It actually encourages you to relax as well. If you want to add another level to this, whereby we're actually trying to encourage the fluid once it goes into the groin to get it up to that left subclavian or to the heart, you can put a book on your abdomen. So if you put a book on your abdomen, then what you're trying to do is then create that deep breathing and working with your abdominal muscles, and then bring it up into the chest wall. And then you can actually start to get that lymphatics moving right through to the heart as well. So not only are you doing your breath, you're doing your movement, but you're doing your elevation. And elevation is something that will always benefit any any form of lymphedema. It will benefit that. An oldie but a goodie, and this is great for scaly skin, someone mentioned that, is dry skin brushing. If you do not want to go out and buy one, just find an old face cloth that's a little bit scratchy, it's fine. The key to buying a brush, though, it must be natural bristle. It shouldn't be a hard, and when you're using it, it's like a sweep, it's not a scrub. We're not trying to, do red raw, we're actually just trying to sweep it, and we're always heading up towards the heart or down, because you're actually trying to make sure that your lymphatics is feeling like it's tingling and moving, and it will help with vascular as well, but the skin always feels amazing. It's a great way to exfoliate. I got asked about types of creams. The key for me is, if you're going to use any cream or any type of lotion on your body, I want you to think about and go back to what I originally discussed about the lymphatics. The lymphatics has got a big job of moving impurities out of the tissue. If you're putting a lotion on your body, it goes through the skin and it's going into the tissue space, so into the fluid area. And if it's toxic in any form, it's another problem for the lymphatics to move out. So you really want something that's non-toxic, lack of perfume, and as organic as you can get so that the body is using it efficiently. If you don't have access to that, something like olive oil would be fine. Just a little bit of olive oil on the skin will actually help bring back the change to the skin structure. But as I said, if you do a little bit of dry skin brushing first, so we always do it pre-shower, so we're kind of sloughing the dead cells off, and then we go and have a shower afterwards. And I'm just about sticking to time. So I'm going to answer some of the questions that I haven't quite covered. One of the ones that was asked about was magnetic grounding. So I haven't found direct research in this, but what I have found, and it's even with NIH, which is a big research facility in the US that monitors a lot, you know, the advantage about magnetic grounding is it does reduce inflammation and pain, but it helps with sleep. And all of those, remember, are going to be factors for what you're dealing with right now, so they will all be beneficial. Another question was about blood tests and lines. Are they okay on a compromised side? I would always say no. The reason being is I come back to the risk of infection. I come back to the risk of the pressure that's actually put on the vein, which will mean putting pressure onto the lymphatics. So where you can avoid, sometimes it's unavoidable, but I would always be wearing a bracelet or something if you've got it on your arm, or I'd be notifying any health professional, because most health professionals would not put a line into that side. Bulge under my armpit, will it go away? That's an in-depth question because I don't know the complexity of what you're dealing with, but my recommendation is go and learn some of these techniques. Go and see if one of Kelly's manual drainage techniques could be done. Do some dry skin brushing and see, because at a chance, if it's a blockage, so coming back to our stream, if it's just that there's been an accumulation and it hasn't known where to flow, by getting a flow going again, you might find it is actually reduced. One of the questions was about monitoring after an LDEX reading and you getting some irregular. I would maintain monitoring. I mean, if it's erratic, it could be coming down to, though, just your lifestyle. It can be the heat of the day. It can be lack of hydration. A lot of people don't hydrate sufficiently, especially when they've got lymphedema. They sometimes think, oh, I don't want to drink anymore because it'll get worse. That actually accumulates protein and accumulates toxicity. So the key is to actually drink more. So monitoring your reading is always going to be prevention. So you're going to have a better insight to what's going on. The key for you is to consider what the weeks or the months that it's erratic, what were you doing different to the weeks or months that you weren't? And then you'll get a good insight. Another one was about a tattoo on the side of where you've had the surgery. It always is going to bring risk. And the reason I tell you that is that working with Dr. Beth Dupree in the surgery that I got to have time with, she's a breast surgeon over in the US. She said she actually sees ink in the lymph nodes. So there's always going to be a risk. I mean, it comes down to we just don't know. And so I would always go, if it's something to make you feel better, it's about quality of life, it's just making a difference for you, then I think that would override anything. But I just want to raise the issue that we don't know the cost to doing the tattoo from a lymphedema perspective. But more importantly, as I come back to the fact that the ink could end up in your lymph nodes. When can I safely have massage for scalp and body? For me, that is coming down to what the surgery was and how long after it and what type of massage you're considering. So if it's a relaxation massage or an oncology massage, it can be 6 weeks post-surgery. If you're talking about going back in and doing deep tissue, I would definitely not be doing it on the side that's compromised for some time. I would give it at least 4 to 6 months because that actually could cause more pressure in the area, which actually could cause lymphedema. So it's always going back to what is the purpose and when do I need it and what is the type of massage. If it's lymphatic massage, then you would be fine to do that even 3 to 6 weeks, but it really is not around the site of the surgery. It tends to be everywhere but. And then after chemo, when can I safely go back to into public? It comes down to how you're progressing through the chemo, in all honesty. Like, what are your bloods saying? Are you under some sort of inflammatory stress? Are you under some immune stress? So, in other words, is your white blood count low? For me, that is part of what I'd be looking at as before I recommend it. You can mask up. At the end of the day, it's actually going, how well do you feel? If you're feeling vibrant and well and you can get out there, great, because social connection and hugs are worth more than anything else as far as I'm concerned. But at the end of the day, it's also being mindful of the journey that you're going through and how you are compromised. So I think that covers it all. Rachel, back to you if we have more.
Desiree, what a wonderful job. Thank you. And I've got all the list of questions here, and I've just been ticking them off as I'm going. And you've done a wonderful job of getting across them. Now, a couple came in while you started talking through the emails. So, and I know you've talked about rebounders and vibration mats, but what about Shakti mats? Is that another?
Shakti mats are great for the parasympathetic nervous system. They're great for sleep. Again, I wouldn't be using them on the site of the surgery and maybe further down the track. But if you're lying on it and your back hasn't been involved, then that would be absolutely fine. Because the key, as I said, is coming back to, can we get you into that parasympathetic state? So the healing and the recovery, because that is always going to be beneficial.
Wonderful, thank you. Now, I think we've answered all our questions that are coming through email, but we've got a couple in the chat here. Now, I'm in a wheelchair, and are there any particular exercises that would benefit me?
So coming back to manual drainage, yes, but if you could have someone get you a vibration plate and put your feet on it, then the lovely thing about that is you'll get the lower extremity as well. So we can actually incorporate that too. Obviously, any sort of dry skin brushing, you'll be able to do that if you have got the ability in the upper region. And so all of those things help. Obviously, you know, when you're in a wheelchair, you may find that you need a lymphatic therapist or someone like that to help you in the groin area. But again, vibration plates, your feet are on them, doesn't mean you have to feel it. You're getting the movement.
Wonderful. Now we've got another one here. So I'm 20 months post-allogenic stem cell transplant for ALL and currently managing some chronic GVHD. I'm on the prednisone and immunotherapy and doing well, but curious to know how the lymphatic system recovers after cancer and SCT. Are there gentle strategies to support lymphatic health, reduce congestion, or help with GVHD symptoms, especially while on immunosuppression?
Yeah, so coming back to pretty much everything we've covered. Breathing, movement, obviously doing some manual drainage. It's not going to be ill-effective. I would be erring on the side of caution of how much manual therapy you had done by someone else just at this point until you were given the sign-off. But definitely all those other hydration, electrolytes, improve the water quality of your body. So in other words, we can get dehydrated. So just thinking about even putting some Himalayan salt, all those little things do make a significant difference. So you can be actively doing stuff for yourself through this process. It's just where the care has to come in is more from sourcing outsourced therapies in the interim while you're going through that process.
Sure, thank you. And everyone, I did put the link to Cancer Rehab PT in the chat as well. So that website, I just looked it up and I've just popped it in the chat for you. So now we've got another one here. Are TENS machines safe, Desiree?
Yeah, they are. Again, you've just got to be careful where you're putting them. So in other words, where are you focusing? My thing is better off to use muscles around the area or around the environment rather than directly on. I never encourage you to put anything directly on the surgical side.
Okay. Now we've got a brave one here. So are cold plunges and spa okay a year after surgery?
To be honest, it's hard to know. The beauty about the cold plunge is it's constrictive. So it means that everything squeezes in. The problem about spas is it's dilating. So it's actually going to open up the vessels. So the concern will be more around the spa or the sauna, for example, as opposed to a cold plunge, because for that exact reason, that if we actually increase the amount of heat in your body, is it going to cause dilation, which means extra blood and fluid flow, which means an increase for your lymphatic system to manage. So I would go in with caution. If you want to just every now and then go and like try for maybe 5 minutes or 10 minutes, do actually test it, but cold plunge would be fine.
Okay, cool. Thank you. Now, what about wearing a backpack post axilla node biopsy and RT for breast cancer? So I guess just
Yeah, so backpack means it's evenly weighted. Where we see a problem is a lot of people have their handbag and they carry half the house in it, and then they have it on the compromised side. That tends to put more stress on the shoulders. The key is that, think about before we were talking about movement. If you change the way the muscles are working in your shoulders, so you become restricted, and that can happen through fascia, which is our connective tissue. So if it's not moving well, in other words, you're getting really hunched over or tight from wearing that backpack, that will impact the lymphatics. Whereas if it's evenly weighted and you're able to manage that weight sufficiently and it's not causing any major muscle issue, then it would be fine.
Okay, great. Is there any benefit in using a rebounder?
Definitely. It's like using a rebounders that actually got more research on them. To be honest, it's been around for many, many years, and I think rebounding's great. If you can't afford a rebounder, just gently bounce on your feet. The key for rebounding, if you want to do it from a lymphatic point of view, is it's not like a trampoline where you jump up and then land back down. You pulse. So you tend to keep one foot or you pulse with your feet together, and then you get a better impact on the lymphatics.
Okay, great. And I'm imagining making sure that you've got good balance too, isn't it? So no falls.
Please, definitely.
Wonderful. Now, what are your thoughts on compression bras, bands, and maybe when to use them?
So they all play their part. So, for example, when you're flying, I would always encourage everyone to wear a compression garment. And where I tend to go, say you've got lymphedema, I wear compression all the time when I'm flying now. It's a go-to for me. There's some really amazing companies. We've found one in the US that's they're expensive, but they're made in France. They're very good, and they're not what I would call that tourniquet compression. But even just wearing the socks is going to help. So I would recommend compression. The key in summer, if any of you have a compression garment, is to put them in the freezer first and then put them on, because they're so cooling. Again, creating that restriction or the constriction in the vessels helps as well. But yes, they do have their value. And if you look at any of the research, if you're managing a lymphedema problem, it does help if you're using it regularly as part of your overall care.
Great. Are massage guns okay to use?
Not on the site. I would not recommend that. If you want to use it up on the shoulder, for example, because you've had breast cancer, that's fine. Everywhere else on the body, but I certainly wouldn't be using. And the reason being, it's a trauma to the muscle. It's a hitting, whereas most effective lymphatic tools tend to be vibration. So it's a gentle change to the fascia and the lymphatics, as opposed to I'm hitting the muscle with strength. That's where it could cause concern from a lymphedema perspective.
Sure. Okay. And last one here is, what about hyperbaric chambers?
So they're really big in the US, and I go there a lot. And so they do play a massive part if you can have access to that. This is more to overall recovery as well. Like it's a lot, as in there's a lot of good research coming out of how it's effective more from a full body recovery, immunity, stress, all those sorts of things, and oxygenation. That's where the key is. I'm not aware of any lymphedema research on hyperbaric, but that's not something I have actually looked up and checked lately. So I can certainly look into it and see if there's anything that's come out as of recent.
Okay, great. Desiree, that's taken us to the end of our questions that have come through in the chat. Now, I'll just quickly look through and see if there's any questions for anybody any hands up, anybody waving furiously, or if there's anything, if anyone wants to. Sorry, we've got one more popped in here. Oh, lots of thank yous actually. So I think, one has just asked here, love to know about the US company with the garments. If that was possible, maybe we could add it into the chat, unless you have it.
Yeah, it's a bit of a mouthful. It's called Elastic Athletics, and I've met the owners personally, and they are going beyond to make one of the best compression products. And the nice thing about it is they do pants and they do full body. I'll tell you a funny story. We've got enough minutes, haven't we?
Absolutely.
So I had a fall and did a compression fracture on my back, and I had to fly to the US, and so I had one of their full body suits, and so I decided to wear this on the plane. And you can imagine me trying to be in the toilet, trying to get this full body suit off and back on again. It was, I mean, I'm just trying to make you all laugh, but at my expense. But I will tell you, the support on my back, and it was phenomenal, and I had no swelling. It was significant. So they have everything from full body shirts, t-shirts. They have full, like you can do pants with stirrups, which is great for those that are managing leg issues. And so if you can't, can you find it, Rachel? Otherwise I'll
just
put
been
it in.
looking. How would we spell it, Desiree?
ELASTIQUE, and then it's
there we go.
athletics.
TIQUE.
They are
I've put it in the chat.
Oh,
Yep.
fabulous, Abby. Thank you. Wonderful.
They are expensive. It's about $240 US for a pair of pants, but honestly, they still look the same a year down the track. So they are long-term use. So they're not something I would, but otherwise you go into the jopes or the more medical-based ones, and for some you may need to be fitted for those. So that's where you'll need to seek help through your oncology team, the hospital, or a physiotherapist to make sure you're fitted to what's going on with you if you're dealing with a staging of lymphedema that's not initially, an initial stage, sorry.
Wonderful. Fantastic. Look, Desiree, we're just about out of time, but I just want to say a huge thank you. I've learned lots and lots, and I've been writing down furiously as well. And I think, there's lots of things in there with the breathing and meditation and the rest and sleep is just, some of those wholesome things about keeping ourselves well and that total well-being, isn't it really? But look, your absolute in-depth knowledge and the information that you've shared has been absolutely wonderful, and we've got so many people just saying lots and lots of thank yous. So big thank you from me, from Look Good Feel Better, but also I know from our online family as well. Desiree, thank you very much, and we really appreciate you coming along. So thank you, everybody. Wonderful to see you all today, and very much looking forward to seeing you at our next session. Wherever you are around the country, please stay warm. And as I say, we look forward to seeing you next time. So take care, everybody. Ka kite.